Hi, I'm Jonathan Small. I'm a podiatrist in the UK who spends his days fixing feet. Heel pain is a common condition that we see, and podiatrists help to fix it all the time for patients. I'm going to be sharing with you 14 must-know facts about heel pain. The first must-know fact about heel pain is that it affects lots of people. Approximately 1 in 10 people will develop heel pain at some point in their lives. That's a lot of people who are unable to walk or carry out their preferred activities without feeling some form of heel pain in one or both of their heels. In 2019, there was a study that showed in a population of over 50s a 9.6% incidence of heel pain, with 7.9% having disabling plantar heel pain. That's a lot of people who are in pain that is affecting their activities. The occurrence was slightly higher in females. It was comparable across the age groups in the over 50s and significantly higher in those with manual occupations. The plantar heel pain was associated with physical and mental impairment, more anxiety and depression, being overweight, and lower levels of physical activity and participation. So it really can have an effect on lots of people's lives. The second must-know fact about heel pain is that it hurts. And I know that might seem like a strange fact, but it does need to be said. In general, those with chronic long-term pain tend to put up with it, and they don't share it readily with others. To outsiders, the person may not portray that they're in pain. They may not demonstrate it in any way, shape or form, when inside their heel is shouting, "This hurts." And it can hurt a lot, every step of every day. And this can affect their mood, their outlook, and their general health and well-being. Every day I see patients who have had heel pain for weeks, months, or even years, who just have an acceptance of being in pain all the time. And that really can cause issues for them in their activity levels, in their approach to their family and their friends, in their attitude towards their lives. And it's important that we work with our patients in order that they can overcome this belief that they're going to always be in pain, that actually we can get them better and get them so they're out of pain and show them what being out of pain is like for them, because that can really have a massive effect on their ability to recover. The third must-know fact about heel pain is that it is both easy and difficult to fix. Both of these are true. In some people, heel pain is easy to fix, especially if the cause is obvious and dealt with promptly. Often some stretching or heel pads or activity modification can resolve the heel pain for them. In others, it can be challenging even for doctors, physiotherapists and other healthcare professionals to fix. And this is where having the ability to assess fully, accurately diagnose and provide individualized treatment plans can make a massive difference to patients, particularly if you've got lots of tools in your toolbox to help them. And that help is available, but you'll have to wait until point 14 to find out how. The fourth must-know fact about heel pain is that there are over 40 possible diagnoses. The term heel pain is not a diagnosis in itself. It's just a descriptive term that doesn't provide any specifics with regard to diagnosis or reasons for it being there. Whereas the term plantar fasciitis is actually a specific diagnosis, but it is only one of over 40 possible diagnoses identified. So if we look at this model of the foot, We can see underneath here the plantar fascia running from the heel bone to the ball of the foot. And you see this red mark here denoting plantar fasciitis. But that is just one of the possible causes, possibly the most common label for heel pain, but not necessarily the most common cause of heel pain. And the difficulty with not getting the diagnosis right is that each diagnosis will have its own specific treatment that's going to be effective for it. So you could get a condition that isn't plantar fasciitis, give advice for plantar fasciitis or intervention for plantar fasciitis, and find that you're actually potentially making the problem worse rather than better. And this is where it's really difficult in places like forums on Facebook, where people ask for advice on treatment from their fellow sufferers of heel pain, and everybody's giving their own bits of advice. But the problem is they might be giving it for all the different possible diagnoses. There's 40 odd different diagnoses for the problem. So without the specific diagnosis, how can you be sure that that advice is going to work for you? So we have to be very careful when we're giving advice on heel pain without getting to that actual specific diagnosis. The fifth must-know fact about heel pain is that it does not need to be x-rayed in the vast majority of cases. And that's because in nearly all cases of heel pain, the only thing that might show up on x-ray is a bone spur. And research has shown us that this is not the predominant cause of the pain. Indeed, many of us, if we had our heels x-rayed, would show up having a heel spur and without having any symptoms whatsoever. And focusing on the results of an x-ray can actually lead to incorrect or ineffective treatments. So having an x-ray for heel pain should not be your first port of call. If I show you the anatomy of the foot, the heel, we have the sole of the foot here. And if we ignore this little bracket here for the stand, but look underneath here, we've got the plantar fascia running from the heel bone to the ball of the foot. So if I remove the plantar fascia, which inserts into the heel bone, we'll then see other things inserted into the heel bone. We've got abductor hallucis muscle. We've got flexor digitorum brevis muscle. We've got abductor digiti minimi muscle, all of which insert into that heel bone, all of which could be the cause of the pain. If I remove these muscles as well, and we go into the deeper tissues, we have quadratus plantar inserted into the heel bone. We have other tendons further forwards if you're getting pain in the arch here, or muscles, the lumbricals here. And if I remove the quadratus plantar and all that complex, then we have the long plantar ligament here and other ligaments inserting into the heel bone. So any of these could be possible causes of heel pain, and therefore having an x-ray is only going to look at a possible bone spur on one thing, which is the heel bone itself. It's not the first port of call. Occasionally, if we suspect there may be a fracture, then an x-ray may be something that we'd refer for, but it's very, very rare to have that as the cause of the heel pain. The sixth must-know fact about heel pain is it is not the same as plantar fasciitis. Whilst plantar fasciitis can present as pain under the heel, in some cases the pain from that condition can be further along the sole of the foot, as the plantar fascia runs from the heel bone to the ball of the foot. So it runs from the calcaneum here to the metatarsophalangeal joints here. Plantar fasciitis is just one of the possible specific diagnoses for heel pain and one of the possible diagnoses for foot pain running along the sole of the foot. seventh must-know fact about heel pain is it can be Achilles tendinitis, but we use descriptive terms in order to identify whereabouts on the heel the pain is to help us to get to the accurate diagnosis. So if we take our foot here and we have the Achilles tendon there with the heel bone here and the plantar fascia running under the sole of the foot here, we talk about plantar heel pain, which wouldn't be Achilles tendinitis, or posterior heel pain, which could be Achilles tendinitis. If there's pain at the back of the heel, yet still located on the heel bone, then it could be known as insertional Achilles tendinitis, as this is where the tendon inserts into the bone. Treatment of this specific condition needs careful guidance from someone who knows how to help, as it is often difficult to resolve. And the treatment plan for this insertional Achilles tendinitis may be different to the treatment plan for a plantar fasciitis. Interestingly, in anatomy, there's fibers that come round under the heel that join these two structures together. It isn't separate. They are actually a continuum around the heel bone. The eighth must-know fact about heel pain is that it can be due to a problem elsewhere, not a problem in the heel itself. You can have pain that's referred from somewhere else in your body, for instance, from a low back issue or sciatica or systemic issues that can manifest themselves as heel pain without there actually being anything wrong with the heel itself. And that's why in-depth assessment should always be carried out for non-resolving heel pain to identify exactly what the cause is and get that accurate diagnosis and then get on the correct treatment plan. The ninth must-know fact about heel pain is that it resolves with exercises. In lots of cases, that is absolutely correct. However, it has to be the right exercises at the right time. That's what really matters. Also, for some diagnoses, exercise can actually make heel pain worse. So getting the accurate diagnosis is really important. For those where exercise is indicated, load management is the key to the resolution of the most common presentations of heel pain. If you overload the tissues too quickly, too much, then you're going to exacerbate the condition, you're going to prolong the condition. By getting your load management program correct so that the tissues can respond to that load, can change, can improve, can heal, then you will get resolution of the problem with a progressive loading program amongst other interventions. The 10th must-know fact about heel pain is that it resolves with heel pads, insoles, orthotics and footwear changes. And again, it can do in lots and lots of cases. It will resolve with those sort of interventions. But the correct prescription and dosage of the device is important to achieve resolution. In the same way, when we take any tablets or medication for systemic problems, then we need to get the dosage right. And that's the same with our prescription for insoles and orthotics. If you're given the wrong dose, then it's not going to be as effective as getting the right dose. If you're given the wrong dose, it could actually be causing you more harm than doing you good. So bear in mind that not all insoles and orthotics are the same. They're all very different. The wrong device or wrong materials can make matters worse, not better. And also, just because one device costs more than another does not mean it is any better than the cheaper device. A custom-made device may not be what's required for your problem. It could be resolved simply with an off-the-shelf device, as long as the materials and the prescription, the dosage are suitable for your diagnosis and your condition and management of it. The 11th must-know fact about heel pain is it is in your head. And I don't mean that you're making it up and it's not real. What I mean is that pain is an output from our brains. We know that's the case. There's been a lot of understanding of pain in most recent years, and we understand it's coming from our brains, and it's affected by many things, including our childhood experiences of pain management, our stress levels, and other things that may be affecting our bodies. This all comes under the biopsychosocial model of pain, and understanding that can really help to beat heel pain, particularly chronic long-term heel pain. It's been shown that on scans where there's been resolution of a problem, but patients are still experiencing pain afterwards, even though there's nothing shown on the scan to denote there being pain. And we work with patients in order that we can help them with their biopsychosocial aspects. So not only helping them with the biology, the localized issue of what's going on, but also with the psychology and the social aspects in order that we can help to get them to be recovered from their heel pain. The 12th must-know fact about heel pain is that it can be dangerous. We use a phrase, when you hear hooves, think horses, not zebras. And what that means is that in the vast majority of heel pain cases, it will be one of the more common conditions, the more common diagnoses causing the problem. Whereas in some cases, occasionally, very occasionally, it may be a rarer cause, and that can include cancer as one of the causes. So it's always worthwhile getting good professional advice for non-resolving heel pain, so we can look at the red flags to help us identify if there is a cause that's a dangerous one, like a cancer is. The 13th must-know fact about heel pain is that it's treated with painful injections. And that's true. It can be treated with injections and they can be painful. Steroid injections are designed to damp down the inflammation, resolve the pain that's often associated with heel pain for some of the diagnoses of heel pain. And those injections can be done in a painful way, but they can also be done in a non-painful way. And I'll share with you a video of it being done in a non-painful way. They're used very often by people who have got limited tools in their toolbox to help with heel pain. So for instance, if you go to see your GP with heel pain, then he hasn't got many tools he can do to help you. He can give you tablets, he can do an injection, he can refer you to physio or podiatry. But to give you some immediate help, he may well choose a steroid injection. The problem with steroid injections is they don't remove the cause of the issue. They don't stop the heel pain from returning necessarily. Sometimes they can resolve it for life, but very often they won't, and the problem will just return. So this is where seeing somebody who's got lots of tools in their toolbox can help, of which injection therapy can be a useful treatment within that toolbox. The 14th must-know fact about heel pain is it is fixed by podiatrists. They are the foot specialists. I ran a survey whereby I asked what percentage of success podiatrists have with resolving heel pain. And the vast majority resolve heel pain in at least 80% of cases. But it's important to realise that not all podiatrists treat heel pain. However, there are many good podiatrists who can provide in-depth assessment, accurate diagnosis, and effective treatment plans, especially those with plenty of tools in their toolbox to help. So if you do see a podiatrist and you don't get the resolution you're after, don't give up on podiatry. That's like saying, I'm going to give up on hairdressers because I had a bad haircut. Or I'm going to give up on butchers because I had a bad cut of meat. You just find another good podiatrist and you will get answers to your heel pain problems. There is no need to suffer unnecessarily, and there's no need to be passed from pillar to post from one profession to another, because if you see the right podiatrist with enough tools in their toolbox, they will be able to help you. So I hope you found it useful, the 14 must-know facts around heel pain. For more information, keep an eye out for the hashtags PodsHealHeels and PodsFixFeet. Please like and subscribe our YouTube channel, Health First Foot and Gait Clinic in Southam, Warwickshire, where we put videos on about all sorts of things relating to feet and podiatry. I'm Jonathan Small, I'm a UK podiatrist, and I'm proud to be a pod.